Good morning, everyone. Thank you so much for being here today. I'm so excited to use this amazing platform to talk about a very important issue. But first, I'm going to introduce myself. My name is Kritika Singh. I'm 16 years old. I'm a rising junior at Basis Chandler High School in Arizona. For my career plans, I've always been interested in the medical field and becoming a doctor. Of course, I still am exploring specific medical interests through research. For my extracurricular activities, I lead a Bloom 365 chapter at my high school, where the goal really is to spread awareness and uproot abuse through educational seminars, awareness campaigns, and other events like fundraisers. I'm also in the National Honor Society, I'm in Red Cross, and I'm recently involved in hospice care. But I want to talk a little bit about my topic for today. So it's something that affects billions. It's something that kills millions. It is something that destroys the lives of many. It is something that is rarely talked about. It's the unseen pandemic and silent killer, abuse and interpersonal violence, which can be categorized into several forms of violence listed here. Abuse and interpersonal violence can be a range of things, including physical violence, sexual violence, emotional or verbal maltreatment, assault, aggression, etc. The central theme of most abuse and interpersonal violence cases is that there's some form of power and control established by a perpetrator. So why is this a global health issue? There's really two factors to consider. For the first factor, we have to consider that we're living in a pandemic within a pandemic. 30% of women worldwide experience some form of intimate partner or non-partner violence, and this roughly correlates to 1 in 3 globally. And if we look at the USA alone, 10 million plus people face abuse each year. If we look at the second factor, we have to examine correlations between abuse and other major issues. 72% of all homicide cases involve abuse, and it's also connected to mental health issues, with rape victims 13 times more likely to commit suicide and also more likely to experience PTSD. Substance abuse and exposure to HIV and other sexually transmitted diseases is also more likely. So not only does this issue significantly impact the world population, but it also severely takes a toll on health and well-being through its connection to other issues, making it a very important global health issue to tackle. Next, we're going to examine the recent rise in development in the rates of abuse. If we look at the graph on the left, it is showing the number of domestic violence cases per capita in the most populated cities in the USA, along with the average fraction of people at home all day from January 2020 to May 2020. If we look at this graph, just within the first few months of 2020, when the pandemic started and people started quarantining themselves at home, we saw a dramatic increase in the number of domestic violence cases. And we are also seeing increased fatality outcomes with these increased domestic violence rates. And if we look at the pie chart on the right, it is data regarding the age at first experience of intimate partner violence. And for the majority of cases, it looks like the ages 11 to 24 are usually the time at which the first experience occurs. So not only is abuse rising and thriving, it is expanding over youth as young as 11, making it urgent that we take action. So why are we seeing these rates rise? Well, first, the lack of awareness and conversation is a huge contributing factor. Simply put, a movement needs people. If we want to uproot abuse in a generation, which is a huge goal, we need a strong and powerful movement filled with enough people aware and participating in it. The being silent essentially is what allows abuse to thrive and expand. There's also inadequate measures to relieve poverty and financial distress. Areas with poverty usually have higher rates of violence, and areas like South Africa are a great example of this. The COVID-19 pandemic has only exacerbated these already rising rates of poverty. So what we need right now is appropriate social organizations, job opportunities, and shelters established in all communities, especially minority communities who usually face higher rates of poverty. There's also increased exposure to violence, with more violence in popular media and more abuse in the home as intimate partner violence cases rise and domestic violence cases rise. People are being exposed to abuse and violence early on in childhood. And some of us might think that simple exposure to violence won't lead to us committing violent actions ourselves, But scientific studies of mirror neurons and observational learning in psychology has shown us that we do in fact have the potential to imitate violent and harmful actions, making increased exposure to violence a very viable factor to consider. So what can you do? Well, the first thing you can do and the most valuable thing you can do is spark conversation and spread awareness. This could be anything like wearing purple during Domestic Violence Month, and posting and talking about domestic violence and how big of an issue it is. This may not seem like a big thing to do, but we haven't reached the minimum level of awareness that we need to actually have working movement and an abuse-free future. So anything you can do to spark conversation and spread awareness will be very valuable. You can volunteer at shelters and give back to those less fortunate in any way possible. Like I said, areas with poverty usually have the highest rates of violence. You can educate yourself and others and utilize and give out resources. If you and the people around you learn about the signs and root causes of abuse, abuse can be prevented on a large scale. And if you ever do find yourself or someone you know in an abusive situation, you have to make sure to use the appropriate resources and confide in a trusted adult ally. And something you can do is you can safety plan, which is basically keeping people and resources in mind ahead of time. So if you're ever placed in a dangerous situation, you know exactly what to do and who to reach out to. You can treat peers with respect. This is probably another really important thing you can do if we want to see a future filled with empathy and love instead of abuse. The things we can do right now matter. And if you treat peers with respect now, it'll be the first step to creating that beautiful future that we all want. You can get involved at school or in the community or legal process. You can do something like I'm doing, where you can start a Bloom 365 chapter in your community or any club or safe space really to learn and talk about these issues. Then for the community and legal process, you can advocate for awareness in your city government, your state government. You can do this through things like proclamations. I also want to mention barriers to getting help. Victim blaming and gaslighting statements are huge barriers to getting help. Gaslighting statements usually minimize, deny, and blame, while victim blaming statements make the victim feel like they could have done something to prevent their own abuse, right? These are huge barriers to getting help because it makes the victim feel isolated and at fault, and that leads to them not reaching out for help. There's also stigma and judgment. Fear of judgment may lead to victims not reaching out for help. Society's expectations play a huge role in victims reaching out for help. And the solution really is to spark conversation to eradicate judgment. The more we talk about this issue, is the more we normalize it. And that's what is ultimately going to lead to more people feeling comfortable confiding in others and reaching out for help. And I want to address top misconception. As we've talked about stigma, male survivors of abuse face enormous amounts of stigma and rarely report victimization because of that fear that they will not be taken seriously or judged. And some of the misconceptions state things like men experience abuse very rarely, and when they do, it is usually less serious. This is not true. Men experience abuse in high rates, even if it doesn't match up to the rates of abuse that women face. It's still very high and very much there. And it can be just as serious. And I highly encourage you all to check out 1in6.org for more information about abuse in males. Some awareness months to keep in mind. February is Teen Dating Violence Awareness Month, represented by orange. April is Sexual Assault Awareness Month, represented by teal. June is Pride Month, represented by rainbow. October is Domestic Violence Awareness Month, represented by purple. Using these months to spread awareness is how you can spark conversation. Like I said, sparking conversation really is what we need right now because we don't have a lot of it. So if you can spread awareness during these months in any way you can, that'll be the first step to uprooting abuse in a generation. I also want to provide my contact information. Please feel free to contact me if you're interested in getting involved with Bloom 365 or you want more information, resources, or help. I also want to give resources to you all on the right. Remember to please call 911 if you or anyone you know is facing immediate harm. Here are my references. And I want to thank the Global Health Leaders Conference at Johns Hopkins University for giving us all the chance to talk about issues we're passionate about. And I want to thank you all for attending today. And I want to thank Bloom 365 for inspiring me to take the fight of uprooting abuse into in a generation into my own hands. And I want to thank you for everything you've taught me. So thank you.